Your Voice, Shropshire Disability Network newsletter, November 2011. Part 3. Include disabled in your decision making. The West Midlands Regional Disability Network is an organisation of disabled people that believes disability is created by barriers in society. Government policymakers can influence important decisions that affect people's lives. There are estimated to be 10 million disabled people in the UK, and only 30% of them receive disability living allowance. Any cost savings should be in the claims process and eliminating error, not in penalising disabled people. West Midlands Regional Disability Network. Disabled people are the experts in their own lives, and their views are an essential part of any evidence base. Involving them in developing policy will help identify gaps in knowledge and give an indication of whether the policy will work in the short and long term. We urge the Department for Work and Pensions to understand the perspective, needs and priorities of disabled people so that the disability living allowance reform will result in a benefit which meets the needs of disabled people and enable the DWP to deliver an efficient and effective public service, says the Regional Disability Network. But feedback from individuals is that the DLA claim process is complicated and long-winded, and that knowledge about the benefit and eligibility to claim is patchy and subject to a postcode lottery effect. As part of this response, we held 2 consultation meetings, which a total of 228 disabled people attended, says the RDN. Our recommendations following on from this consultation is that the DWP sets up a working party of disabled people and public sector officials to co-produce a better process for claiming disability benefit. Response to consultation. The RDN says, "We have not responded in detail to all 22 questions because as an organisation of disabled people, we feel that some questions are most appropriately answered by individual disabled people, and the questions themselves invite a diversity of responses because disabled people have different impairments. The experiences of their impairment will not be identical to others, and their life experiences, education, employment, housing, family circumstances will vary as much as it does in the general population." For the full RDN response, go to www.rdn-wm.org.uk. Here we take a quick look at just 3 of the questions. What are the problems or barriers that prevent disabled people participating in society and leading independent, full and active lives? The problems and barriers most identified are cost, affordability, low income, inaccessible transport and buildings and inaccessible homes, anxiety about personal safety, travelling and new environments, lack of choice in employment and in leisure, and a lack of opportunities caused by a restricted education. What are the main extra costs that disabled people face? Many have to spend more than non-disabled people to maintain the same standard of living. More disabled people live below the poverty line than the general population. Costs are not only financial, but a missed opportunity cost too. It can often take longer for a disabled person. Journeys on public transport, getting around the shops, getting in and out of buildings. How can we best ensure that the new assessment takes account of variable and fluctuating conditions? By asking expert practitioners, GPs, hospital specialists, OTs, physios, who know the claimant to provide evidence. By asking the claimant about a range of time, as is currently done for the review of efficiency of treatments provided for some chronic conditions, not just a snapshot. By asking the claimant about best and worst times and not penalising a claimant for sometimes being able to carry out tasks. By producing the design of assessment with disabled people. How could we improve the process of applying for the benefit for individuals and make it a more positive experience? For example, how could we make the claim form easier to fill in? How could we improve information about the new benefit so that people are clear about what it's for and who is likely to qualify? It is really important that disabled people are involved in the design of the new form, not just asked to comment on a revision. In terms of promotion, frontline staff should be properly briefed in who the new benefit is aimed at and likely qualifying criteria. Promotion to all who could benefit should be adequately funded, and full use should be made of voluntary sector agencies which have disabled members and service users. Growing SDN has new roles to be filled. Shropshire Disability Network is growing. This is good news. It means we are reaching more people and saying and doing things that are relevant and worthwhile to the lives of people with disabilities, their families and carers. But it also means more work, and the original steering group needs to grow to help meet these new demands. We need additional volunteers with skills and experience in particular areas. Set out below are details of some of the roles we would like to fill as soon as possible. If you're interested in anything you read, then please get in touch, but equally, don't feel bound by our role descriptions. There is always a valuable part to be played by everyone who wants to volunteer, both those with disabilities and those who are able-bodied. We need an events coordinator. Ideally, this will be someone with previous experience of managing events or projects, which might include experience of arranging a wedding, family party, village social, PTA or church event, etc. The role involves good organisational skills and the ability to encourage participation and support teamwork. You will need the ability to work within a very limited budget and have an unflappable disposition. You will work closely with members of the management group. We need an administrator. This role will support the growing administrative needs of SDN and its main features, including creating and maintaining an easily accessible records capable of being shared with a range of users, and assisting with correspondence. Knowledge of email, Microsoft Office, and similar software packages will be an advantage. Both these roles will require good interpersonal skills, and it will involve dealing with SDN members and supporters, plus the many organisations we deal with, such as Shropshire Council and the Community Council of Shropshire. Your Voice Assistance. This newsletter is currently produced in 4 formats: online with full graphics, as plain text online, on paper, and as audio for YouTube. There are plans to add a CD version to the list. Much of the workload of creating the plain text and YouTube versions currently falls on one person, and she would like help. Also, an email alert is sent out to hundreds of readers when a new edition goes online. This is an invaluable contact with members, supporters and interested parties, and can be used to alert them to the top issues of the moment. But as numbers grow, so does this role. The editor would like someone to take on this important work and help develop it even further. All necessary training will be given, but familiarity with basic computing and emails is necessary. If any of the roles described here are of interest, please email newsletter@shropshire-disability.net. If reading this has prompted you to think about volunteering in some other way, please also get in touch for a chat. Good Samaritan gets your voice into print yet again. Work continues on extending the number of ways in which your voice is made available, in addition to the online version. The printed version is now a regular monthly feature, but not without a few tearful and fearful moments along the way. Thanks to brilliant support from Landau, a Wellington-based supported employment and training organisation, the paper version has been printed on time for the past 3 months. On behalf of our non-IT readers, SDN is pleased to say thank you very much for the rescue operation. Sonia Roberts and her team at Landau stepped in just as things were looking impossible, enabling Trevor Dickinson and Ruby Hartshorn to get the paper version posted to our members on time. We are hoping to produce a CD version. If you feel a CD would be more appropriate for you, please contact Trevor on 01952 261146 or Ruby on 01743 340 832. Footnote: we can't let the moment pass without explaining more about Landau, which describes itself as a supported employment and work-related training organisation, providing one-to-one individual support for people with learning disabilities to ensure that every person with a learning disability has the opportunity to work and fulfil their potential. Its aim is to provide high-quality, tailored support to enable people to overcome obstacles. For more information on Landau and its work can be found at www.landau.co.uk, or you can contact them by email at admin@landau.co.uk, or you can call them on 01952 245 015. Too few with learning difficulties get post-16 education, says Ofsted. The development and quality of provision for learners with disabilities and/or learning difficulties gets a mixed response from recent Ofsted work. Its findings add weight to plans to improve transition arrangements detailed in the SEN and Disability Green Paper. Whilst Ofsted found some strengths in provision for disabled learners, it also highlighted issues that have been of concern for some time. It proposes a number of changes to place greater emphasis on the impact for learners and reduce the focus on policies and procedures. These are extracts from the report. Too few young people with learning difficulties and/or disabilities progress from school to complete programmes of learning in post-16 settings. An estimated 30% who had a statement of special education needs when they were in Year 11, and 22% of young people with a declared disability were not in any form of education, employment or training when they reached 18 in 2009, compared with 13% of their peers. Ofsted inspectors conducted 111 detailed case studies of learners in a range of settings, including colleges, independent providers and local authority providers. A key finding was that local authority arrangements for transition to post-16 provision were not working effectively. In 2/3 of study cases, the providers had not received an assessment, and where they were received, they were often lacking in specific detail or arrived late. The timing of local authority arrangements was not aligned to post-16 providers' recruitment and induction. Other findings included recommendations for further study at post-16 were not sufficiently objective or based solely on need. Work-based learning provision was rarely considered an option. Provision at post-16 varied considerably. Very little provision was available locally for learners with the highest levels of need. The current arrangements resulted in inequalities in the placements for learners. Recent reductions in budgets for adult learning and further reduced the options available to adult learners. The colleges visited had effective transition and assessment arrangements, which included circumstances where no local authority learning difficulty assessment had ever been received. The independent providers had fewer specialist staff, but their initial assessment arrangements worked well. Learners on mainstream provision, including apprenticeship programmes who were receiving additional support, were well supported. When learners had their support needs discussed with them and reviewed, it was common for adjustments to be made to the support provided and for learners to become more independent in their learning. Foundation learning programmes were successful for learners whose main goal was to progress to Level 2 provision or higher, but for those learners for whom this was not a main goal, they were too narrowly focused on accreditation. The programmes seen offered too few meaningful opportunities for work experience and for other practical learning situations in which to develop skills. Foundation learning in post-16 settings could only be funded for around 3 days a week, which was insufficient time to prepare learners effectively for other destinations, in particular some form of employment. When learners reached 19, changes in arrangements between children's services and adult services created additional difficulties. This has been taken from www.ofsted.gov.uk/progression-post-16-4-learners-learning-difficulties-and/or-disabilities. Wanted. Wheelchair users for online research. Scope has issued an open invitation to wheelchair users and their carers to take part in a research study by Loughborough University. We are looking into how access information may be improved online through including Wikipedia-style information, the researchers say. They need wheelchair users to spend 30 minutes on their website. Every participant will be entered into a prize draw to win £150. Visit www.freetraveller.co.uk. Survey shows big impact of plan changes. At 12.7 billion of means-tested benefits remains unclaimed, yet 30% of disabled people live in poverty. In August 2010, the UK Disabled People's Council commissioned a survey among disability organisations about the coalition government's proposed benefit reforms. Some 300 organisations were polled over 3 weeks, with a response rate of about 30%. Analysing feedback shows the proposed reforms will have far-reaching effect on many. A number of primary areas of concern rotate around 2 areas in particular. Firstly, that those with hidden impairments or fluctuating conditions will be worst off under the benefit reform proposals. Secondly, there will be a big increase in numbers seeking help or advice from all organisations asked. These organisations do not and will not receive enough funding to provide this support. In 2008 to 2009, £12.7 billion of means-tested benefits were unclaimed, yet 30% of disabled people live in poverty. User-led disabled people's organisations, many of which have years of experience dealing with issues in their locality, are vitally important to ensuring the needs of disabled people are not overlooked during local service reforms. We are approaching a period where local services are likely to be cut or reduced due to council tax freeze. Ensuring these disabled people's organisations are fully operational will hopefully prevent disabled people falling through the cracks due to the changes. Many disabled people's organisations are concerned that the funding they receive from local authorities will be cut, and therefore they may cease to exist. People who are ill due to stress, or whose impairment worsens due to stress, will be worse off if they are made to endure stressful medical tests or worries over their financial stability or outlook. This could cause a multiplier effect. These people may need treating by the health services and increased social care support, thus increasing the costs to the state. Shropshire 3-Day Disability Film Festival. Disability films from around the world were shown at the Disability Arts in Shropshire Film Festival in October. Filmmakers have been sending in their works to DASH for the last 12 months, and there were entries from Canada, Australia, Sweden, Iran, Italy and the United States, as well as the UK. Learning disability was the focus of involvement in films from the Oscar Bright Film Festival based in Brighton. The festival included films from the past about learning disability, and there was a brand new Your Rights at Work short film created by the Disability Law Service. Nicola Lane, one of the UK's leading disabled filmmakers, showed her work, followed by an audience discussion on disability arts. For further information about DASH, you can call 01743 272939, and for full listings of what the festival included, you can visit www.arts.org/newsarticle.jsp?news ID equals 312. DASH is based at Unit 4, Hartley Business Centre, 272 to 284 Monkmoor Road, Shrewsbury. The postcode is SY2 5ST. Don't miss your flu jab for the winter. If you're a person with disability reading this in November and you haven't had a flu jab, then get a move on. Many disabilities, including but not limited to neurological conditions such as MS or cerebral palsy and diabetes, put you at far greater risk than the non-disabled. Last year, more than 600 people died from flu, and most were in clinical at-risk groups. The flu vaccine is free to everyone in this group, plus the main carer of an older or disabled person. Get in touch with your GP practice and make an appointment.